Good afternoon. Good afternoon, and thank you all for being with us today. And again, I want to begin with a special thank you to members of the media who have been fantastic in helping us to get the message out and communicate important messages to Rhode Islanders. The number one thing that we can do right now to keep ourselves safe and healthy is to stay informed. So I want to thank all of you who are doing that. Again, I just have to begin by thanking Dr. Nicole Alexander-Scott and her team for all that they are doing. This is an unbelievable effort. All of my directors are working so hard on this effort. I want to say thank you. To the frontline healthcare workers, we hear you guys. We know it's getting more and more difficult by the day. We want to do everything we can to support you, and I want to thank you for your cooperation, for your hard work, and for all that you're doing on the front lines to keep Rhode Islanders safe. As I stand here today, as many of you know, we're currently up to 5 cases of coronavirus in Rhode Island residents, 5 cases, hundreds of people in quarantine, and we continue to test many people each day. Our approach thus far has been to be very aggressive and swift. We want to take aggressive, swift action so that we can contain the virus. Thus far, that action has enabled us to get to a place where we only have 5 Rhode Islanders who have tested positive for corona. The number one goal right now is containment. We're operating on that principle. Every decision we're making is with the goal of containing the spread. To do this is an exercise of judgment and balance. Every decision that's made requires judgment and balance, because we understand that people have to live their lives and business has to continue. However, we only have one chance to contain this. This is one shot to contain it. So the measures that I am about to roll out, Dr. Alexander-Scott are about to roll out, are aggressive. They are calling for radical change in the way we live our lives for a period of time and the way we do business. We believe that that is what is necessary in order to change behavior so we get this right and we can contain the further spread of coronavirus. At this stage, the question that we are getting the most of, constant questioning, is around should events be canceled and how big of an event is too big to hold. So after a great deal of thought, consulting with experts, consulting with the CDC, we are here today to offer some specific guidance as it relates to structured, organized events. I want to emphasize that what we are about to provide is guidance, and that every decision that every one of us makes, every business, every school, every church, every organization, has to exercise a certain amount of judgment. So let me lay out what I have been calling the gold standard. If you are able to have the most ideal set of circumstances for large events. Number one, nobody who was feeling sick would be out. That is absolutely vital. And I am asking every single Rhode Islander to stay home if you are sick. If you're a little bit sick, if you have a low-grade fever, a little bit of aches and pains, please stay home. Be a hero. If you stay home, you'll be helping every other Rhode Islander. So we don't want to have folks who are symptomatic out at events of any kind. We all want to be avoiding close contact. The rule, which the doctor will go into, is 6 feet. Broad arm's length of contact, 6 feet. You all might want to start moving away from one another, members of the press. Cover your mouth if you cough or sneeze. We all know it. Wash your hands frequently with soap and water. Clean surfaces daily. This is what we all need to be doing. This is a moment, so often I hear, Governor, what can I do to help? What you can do to help is stay home if you're at all sick. Okay, to that end, with that being the gold standard, we are going to lay out some specific guidelines. I am now calling on all Rhode Islanders to not attend or organize organized events of 250 people or more for the next 2 weeks. That's a guideline that we're asking all Rhode Islanders to follow. Do not attend or organize events, 250 people or more. We're defining an event as an organized occasion where people will be in close proximity for an extended period of time. Sporting events, spectator events, parades. This recommendation is in line with the CDC guidance issued last night for areas with minimal to moderate community transmission, which is where we are now. Rhode Island is fortunately in a place of minimal to moderate community transmission. We'd like to stay in that place for as long as possible, which is why we're putting out this guidance of events 250 people or more. I want to be clear again that this is a guideline. This is a guideline, and we all have to exercise judgment. The nature of the gathering matters. A more controlled environment is different from an environment where, which is less controlled. Events of any size, where folks are able to be several feet apart, where everybody who's entering the event is able to be verbally screened, such that folks who are sick are screened out. Those events where those precautions can be taken are a little bit less concerning. Large gatherings where people are close together, there's no ability to find space, there's no ability to have regular cleaning, there's no ability to screen out folks who are sick, are the most concerning, and we're asking that you shut them down for a period of 2 weeks. I want to make a few comments about a couple of specific populations. First, I'd like to address the high-risk populations, and we're hearing a lot from the senior community. We are urging that anyone 60 years old or older, or anyone with an underlying health condition, not attend any events for the next 2 weeks. We're doing that because these are the populations that are the most vulnerable to this particular disease. It is worth noting that last night the CDC came out with guidance that organizations which serve high-risk populations should be canceling events of 10 people or more. I'd like to make special comment about our K through 12 schools. K through 12 schools. At this time, we are not recommending that schools close. I want to reemphasize that. It is not our recommendation for schools to close. There's a few reasons that schools are in a different category. First, we know that children are faring relatively better with this disease. Secondly, closing the school has significant implications for the entire community and the entire family. Many children rely on school to get 2 meals a day. Many children will not have adequate child care if they have to stay home, or they may be left with elderly loved ones or relatives, which is even more dangerous. In specific instances, such as St. Ray's, we have urged closing the school. That's an instance where somebody was there who had tested positive. In those instances, contact the Department of Health. The Department of Health will work with you and will recommend a particular closure for those particular instances. But as a broad policy, we are not closing schools at this time. We are, however, RIDE will be shortly issuing specific guidance to help schools so that teachers, parents, children can remain safe while school is open. This guidance will include no school-wide assemblies or events of any kind of 250 people or more, in line with the guidance which I just offered. By the way, any individual school may decide to go lower. You may decide 100 or fewer, and that would be your decision. Wherever possible, space students far enough apart so that there's that appropriate social distance. Adopt tighter visitor policies. Do everything you can to verbally assess the sickness level of everybody entering the school, and adopt more frequent cleaning policies. I will say we have been in constant contact with principals, teachers, superintendents, school department. I understand every school is a little bit different in size, different in nature, and so we are providing our best guidance at this time to help you keep your children safe. Any questions, we are putting more people on to staff our hotline at the Department of Health, and I would encourage anybody to call at any time so we can help you step through the details. A special note to businesses, we aren't recommending at this time that businesses shut down. In the past few days I have talked to hundreds and hundreds of businesses. I realize this is an unbelievably trying time, and I want to thank each and every one of you for your incredible effort and collaboration. We want you to stay open, and we want you to conduct your business to the best of your ability. If you can send your employees home to work at home, do that. Allow people to take time out if they are sick. Pay folks while they are sick. Take advantage of the emergency TDI and unemployment insurance that I announced the other day. We also want to recommend for businesses that have consumers who will be interacting and might be in lines, take special consideration to how you can amend the way you interact with your customers so that folks can have an appropriate amount of distance while they might be in line. Now I want to be clear about this. The balance here is we are also trying to operate in our economy to the very best extent possible through this. So if you are a person who is under 60 years old and you feel perfectly healthy, it's okay to go to the grocery store, to go out for dinner. My family and I went out for dinner last night. If you can support the local economy, you're young, you're healthy, everyone in your family isn't sick, you ought to do that. But we want you to be smart about it. You'll notice here, members of the press, we tried today to separate you. Let's lead by example, guys. We're leading by example. Everybody, I understand what I'm asking for here is unusual. It is radical. It's 2 weeks. We have one shot to get this right. Everybody get in the boat, row in the same direction so that we can put a lid on coronavirus before, as we've seen in other places, it gets out of control. If you have any, also, all of my press conferences are being live streamed on our Facebook page, which anyone can access remotely in real time. Any member of the press corps who has questions, please get in touch with the press team and we'll make sure your questions are answered. This is where we want to start to go. If you can do something by phone, do it by phone. If you can do it by Skype or video conference or Zoom, do it that way. If you can send an email versus an in-person meeting, go ahead and do that. Another reminder, the Department of Health Coronavirus Hotline, 222-8022. Businesses have questions, schools have questions, senior centers have questions. We've provided guidance. The guidance is on the website, but if you have specific questions, please call and we will help walk you through the best action that you should take to keep your community safe. So, in closing, if you remember nothing else, stay home if you are sick. That's critical. As Dr. Alexander Scott will explain, the risk of transmission and contagion is much lower for folks that are asymptomatic. Stay home if you're sick. Avoid large group gatherings. Keep a distance between you and your neighbors. And recognize that if we do this now, and everybody follows these instructions for this short period of time, we'll all be better off in the long run. Several people have said to me, what happens if? What happens if? The answer is we're dealing with this a day at a time. Okay? We're dealing with this a day at a time. I will continue to interact with members of the public and the press as often as needed, and we will update and adapt our response as necessary as conditions change.